This is AP Med. My name is Andrew Poveda, and today I am interviewing Dr. Sol de Jesus, a neurologist at Penn State. Do you want to introduce yourself? Tell me a little bit about your background, history, culture, anything?
Thanks, Andrew. Yeah, it's wonderful to be here today. I am originally from Puerto Rico. I was born in Puerto Rico, but raised in New Jersey. In Union City, New Jersey, is my primary place of where I grew up and did my schooling. I did most of my training in the mainland United States, but I did go back for medical school in Ponce School of Medicine in Puerto Rico, and did my internship year there before I came back to Pennsylvania region for my residency in neurology. I did go on to fellowship for movement disorders. And so my focus is on treating individuals with Parkinson's disease, essential tremor, and even further subspecialized in areas of deep brain stimulation therapies for people with movement disorders. And so that's been my primary focus in practice. I've been back at Penn State as a faculty in my grown up position. This September, I make 10 years as faculty back at Penn State, where I did my residency for neurology.
Congratulations.
Thank you.
I love touching a little bit more about the background of people and like how they actually are like humans. Do you want to tell me a little bit more about your hobbies and who you are as a person outside of medicine?
That's a really important question, and I think one that often gets overlooked, particularly as you're training to become a person in medicine, and once you're out in practice. But uh, I do feel that in my more recent years, I've been more aware of that important question that you ask. Outside of medicine, I my family lives near me now. For my training period, there was a lot of time where I was away from my family, and that's a big part of my life. And being able to hang out with them, listen to music, cook, just join together and have game time or family time. With my fiance, we enjoy the outdoors a lot. We love hiking. I love biking when the weather's good, going on trail rides. And he's an avid rock climber. And while I have uh, my anxieties about rock climbing with what I do in neurology, I do a little bit of that along with them when I get an opportunity.
Great to hear. Yeah, I like hearing a little bit more about people and who they actually are as a person. So I like to hear that you're really active. Rock climbing, that's really nice. I rock climb too, actually.
Do you do some bouldering or more of the rope climbing? Do you have a preference?
Bouldering. I just started actually, so I don't know too much about it yet, but I have a
Yes.
friend that got me into it. Yeah.
Yeah. That one is because you don't have the security of the rope, but you're doing smaller climbs. That's
Yeah.
what my significant other does. But I do more of the stuff on the rope because I feel like I'm a little bit more secure when you get caught if you fall.
Could you tell me about why you chose to pursue medicine in the first place? Was it something you wanted as a child? Was it something that just came about through an experience? Could you tell me a little bit more about that?
Yeah, I think, my journey wasn't necessarily straightforward where I knew that I wanted to do medicine. Um, when I was in high school, I had a really good friend who was applying for college because they wanted to be a lawyer. And that was my first introduction into higher education beyond high school. Once I graduated, and I was applying to all the same programs she was applying to, and we ended up going together to the University of Scranton in Pennsylvania. When I went into college, I went in undecided. I loved learning about everything, and so I wasn't sure exactly what I wanted to pursue at that time. And so I would go to career fairs, and there was a pathway for undecided students there that exposed you to different areas. I've always enjoyed science. I've always enjoyed learning.
Hmm.
Um, and so I gravitated towards neuroscience, where it put me in classes with other pre-med students. And at the time, I remember I used to love reading a series that involved an FBI medical examiner who would solve cases and was, not only doing the medical examiner part, but also was with the criminal justice system. And I use that as sort of an inspiration for myself of enjoying that aspect of neuroscience and puzzle solving and um, having had that influence from my other pre-med peers, I decided that I wanted to go to medical school to figure out how to do that. Like that's how I ended up with the medical sort of bug. Once I went to medical school and I was looking between pathology and neurology, I gravitated more towards the topic of neurology, and the opportunities that you have with making connections with people in the neurology space in terms of the patient population that you treat. And so it just for me, it kind of was happenstance of trying to figure who I was as a person, what were the areas that I enjoyed. I could have gone into research with neuroscience, but I really wanted the human connection piece that you get from the clinical practice, which then drove me towards the medical school route. Um, and so, I didn't have one particular plan in place, but I think little things along the way sort of veered me towards that direction.
Okay, got it. And did you ever consider doing something in law and medicine? Because you mentioned that you kind of dove first into that. Did you ever think about like medical malpractice law or anything related to that?
Yeah, it's really interesting. I thought about forensics medicine as a possible area where pathology would have allowed me to do more of the medical examiner piece. I did get a minor in criminal justice. I thought really I was going to go towards
Okay.
that space, but it just never. It wasn't. Once I actually went out and rotated and saw what neurologists did and got a better understanding of the pathways to both. Um, I gravitated and stayed mostly on the medical side. But that I always joke around and I say in another life I may have been an FBI, criminal justice, some sort of medical personnel involved in that.
Mm. Okay, okay. Oh, can you tell me one thing that most people get wrong about your specialty? Because I hear neurology, I think the brain instantly, and what's one misconception that happens in your specialty?
The one I think the common one is that you can't do anything in neurology to in the sense of curing people, right? I feel like neurology in particular is one of those subspecialties that has experienced the most growth over the last few years, and will continue to evolve at a rapid pace based on how technology is changing, our understanding of the nervous system, uh, medications, and therapies that are being investigated at the moment, right, to try to help individuals with neurological disorders, genetics, our understanding of genetics. And that was actually one of the reasons I was attracted to the field to begin with is I knew that there was still things that were being discovered and it wasn't all known, in terms of the nervous system. Um, and while there are some conditions, like I am in my area of movement disorders, something like Parkinson's disease, right? There isn't any cure for Parkinson's disease, but there's quite a bit that you can do as a role in a neurologist when you're managing patients and their family members with that condition that lead to significant improvement in quality of life, and that could be, in a sense, seen as the management itself, although it's not curative, is impactful in how someone may experience their condition. And so this idea of, oh well, oh it's depressing. There's not a lot that you can do in this space. Difference is like someone who may be a surgeon can go in there and remove the thing that is causing the issue, and that's it. That sense of satisfaction can be something that people are seeking when they're looking at different subspecialties. The one for neurology is that, I think that's changing. It has changed for a while, and I try to always counteract that misconception that you really can't cure or manage somebody with a neurological condition.
Yeah, I hear you mentioning a lot that like idiopathic conditions and things that are like always improving in the field. Like I think cancer. I also think of how you mentioned pathology earlier. You were like, well, they're hard conditions to solve in a sense. So, oh yeah, I just wanted to ask you a little bit more about the deep brain stimulation at Penn State. I know that was the first one in Pennsylvania. So could you tell me about how that started up and how it improved and how much of an advancement it was in the field of neurology and movement disorders?
Yeah, the deep brain stimulation has been around for over 20 years, and it's approved for different conditions. In For what I see in my particular area or space, for Parkinson's disease, for people that have essential tremor, and individuals that experience dystonia. It's also approved for like epilepsy and refractory obsessive compulsive disorders. But I focus on the movement disorder side.
Okay.
It's a therapy that has been impactful for patients in areas of like shakiness or mobility changes as a result of their condition. But it is a brain procedure. So I work collaboratively with the neurosurgeons. We have our neuropsychologists, we have physical therapy, we have advanced care providers. It's a whole team approach when someone is considering something like the deep brain stimulation. What we had an opportunity to do here in Pennsylvania is the technology advancements have allowed it for the system to become what's called closed loop, meaning that we can set parameters on the device to tell it to change as the patient is changing throughout the course of the day. Before this, the stimulation would be set and it wouldn't change or adjust depending on how the individual is doing. And so because we had done some work with some of the initial sensing capabilities, we had the opportunity to be the first one in the area to turn it on once the technology became approved. We continue to learn. We still don't quite know um, overall who is the individual that's going to benefit the best from this, or how it's going to change how we think about management with the device in the future. But it's been great to be a part of that process of understanding the technology as it gets rolled out in the clinical space.
So in Spanish, where you speak Spanish, there's a word confianza, which means
Mhm.
confidence, but also it means trust. So do you believe as a Latino, do you believe that Hispanics in general are less prone to seek out professional care and professional help in terms of things like neurology, because neurology is such a specialized field that most Hispanics would, especially older individuals, would shy away from seeking out that care. So what do you say to those people um that have that distrust in them and don't have that confidence in
Yeah, in this space with what I do,
them?
um, and in neurology in general, I think there's been an awareness, not just in neurology, but because I'm in this space, that there's a couple of different factors that impacts someone's perception of or access to a field or a subspecialty. And it does take the education of the whole community, of providers that are engaging with them at a primary care level, with communities to meet them where they are at, and understanding what may be some previous experiences um, or or factors that they are concerned about should they pursue something like seeing a neurologist. Um, but I do think that it's also an understanding of what some of these symptoms may be and how there are treatments that can help improve how can somebody function and their quality of life. So I do think it takes we have to tackle it from multiple areas, because sometimes the person doesn't make it to the specialist, like in my practice, because nobody refers them to us, right? It's not necessarily the individual who's concerned about going to the neurologist. It's just the access of somebody thinking about sending that person over. But how an individual thinks about something like surgery, like something like the deep brain stimulation, or the treatments, or a diagnosis of Parkinson's disease, can be influenced by um, their background, environment, how they perceive limitations are. And I do see that in practice all the time. And it really is about meeting the person where they're at, in terms of what they're willing to engage with in terms of management. It's about education and shared decision making, so that when we're talking about next steps or plans, or being seen by somebody like a subspecialist in neurology, um, it's still the individual and their caregivers that are feeling like they're at making the decision and not being told this is the next thing that you have to do. So I do think it takes
Okay.
education, community engagement, um, and sometimes, frankly, it takes seeing somebody that is of your same background, which is why it's so important to be able to communicate in the language that you feel most comfortable with. And so keeping that in mind can sometimes also change perceptions of diagnosis and different treatments in practice.
I was actually waiting for you to mention, well, I saw online that every month you have a meeting where you discuss the deep brain stimulation and like the clinical trials involved with that, meeting with people that are interested in it. Could you tell me a little bit more about that and what you give out in these presentations?
So there's different opportunities for education, and there's a seminar where they talk about the device, and
Mhm.
the person has a chance to ask questions about what the system is and what it may mean for their particular condition. Where I engage most of the time in education is when I see the individual in practice, or when they're coming through the screening clinic, where we talk about confirming the diagnosis, seeing is there anything differently that can be done that's not a surgery, and then more importantly is talking about the expectations of what they hope they get out of this surgery. Because if the expectations don't match, that's where you have failure of seeing that improvement, or the individual feels like they didn't get the results that they were hoping for.
Okay.
Because there's so much right now where patients can get access to this information online, and there's videos and there's patient stories and there's direct to patient advertising. Um, every patient that goes through this procedure has a very unique journey, and it's not expected that all the symptoms are going to improve. And so what I try to do through the education piece is taking them as an individual and helping them understand based on their specific symptoms what they can expect from the procedure, so that there's better understanding afterwards of what we could anticipate with the therapy.
Okay, so now to change the topic off of purely neurology, do you want to tell me a little bit more of how you've been as a advisor for the LMSA at Penn State and your favorite experiences or anything related to that matter?
Yeah, I think, when I first started back in the faculty position in 2016, um, as a new attending, you sort of get presented with a lot of different opportunities for engagement. And one of the ones that over time came up was the possibility of taking over as a faculty advisor for the LMSA group. We are oftentimes we're so siloed in medicine. You're just with your particular groups, with your particular subspecialties, that having taken on the role of the advisor, for me it opened up a community here at Penn State that didn't know existed. And so the students taking on the board of students through LMSA, the thing that I was always so proud of and excited about was you know collaborating with others and really showing the community that exists within this space here, um, and provide education, resources, times where you just go and sit and have a cafecito with the group and just be present. um, the board and the students are doing just amazing work, not just within the community of Penn State, but outside of within our communities in the regional area and with the interactions at the national level.
Mhm.
Um, for me, it's just been I, I feel like I don't do much. I just get to view these amazing individuals really creating opportunities and connections out there that I think are necessary and really have changed the culture of in this area. And so I'm just proud of the work that they've done in that space.
So speaking more about connections and networking in general, how have mentors helped you out and how have you mentored others giving back to the community?
Mentorship is critical. Particularly, I was the first one in my family to go to college and graduate. There was no other doctors in the family to help guide that process. We came from low resource, a family of low economic resource. So there was a lot that I did not know going into college and pursuing medicine. And if it wasn't for individuals that took an interest, helped guide along that path, I don't know that I would have been able to see what was possible. Sometimes they saw things in me that I didn't recognize in myself at the time. And so having those types of individuals along the way is really important. Um, there are some mentors that are lifelong, and I will, I've known them now for most of my academic um, journey. There's others that are going to be there just for short periods of time, and there's going to be a very specific role that they're going to fulfill for the individual, the mentee. But it really is it has to be a reciprocal connection, right? So as one of the things that I've recognized over time is as a mentor, I have these experiences that I want to share and opportunities to point out or guide somebody in their path.
Mhm.
But I also learn from my mentee. And I say one of the best things that you can do is be proactive as a mentee to make sure that you're getting what you need from your mentor, because once that if you're not getting that from that particular person, it's not a failure of that relationship, right, of mentee mentor.
Yeah.
It may be that you need to find another person that can help guide that particular next mission or next path. What I try to do is for when I'm, if someone requests me as a mentor, and I've had mentees at every stage of my career, from a resident into a fellow into a faculty position, because I have been able to, at each of those, have experiences that I can share with others.
Mhm.
What I've tried to do is make sure that we set up a clear understanding of what that would look like, and open up the space to say, if this is not working for you, let's talk about it so that we know, am I still the right person to help guide you in this path? Or can I identify somebody that can help you? I've tried to do it from with communities of underrepresented students that have some different challenges as myself in entering something like medical school.
Yep.
But I mentor anyone who, even colleagues that are junior colleagues, to know what to do from an attending perspective now that I'm sort of mid-stage attending. So mentorship can look like a lot of different things, and it's just finding that person that has that believes in your path and can help guide that along the way.
Okay. So you've moved from country to country and you've had big changes in your life, right? So how have you navigated in meeting and finding a community at the new places you moved to?
I have to say, it does get harder as you get older and you're moving away from college, right? I think that's just a natural thing that happens for all of us that go on to higher education. Um, with each of the times that I've moved, you just tend to gravitate towards um, like-minded individuals, or you find connections based on certain hobbies or interests and previous experiences. And so I've been lucky enough that at each phase of having moved or gone to the next step, I have felt that I have been able to make those connections. Sometimes it did take putting myself out there, right? And being uncomfortable with the possibility of not connecting with somebody in the way that I anticipated, or having the other person just not gravitate or connect with me to create those groups. But I do think that having a core group at each of the steps was instrumental in feeling like I could overcome when times did get challenging. Because it's great when you have that community when things are going well and you're excited and you're having those moments to just relax and hang out and be a person. But having those individuals, particularly that could understand where you were at and what challenges you were facing, um, were helpful for the harder times. Um, that's why it's also important, not just like making new groups of connections where you're at, but making sure that you're cultivating the relationships that you already do have, because sometimes it takes time to build that community in the new space.
Hmm.
And we have people throughout our whole lifespan that really care about us, family, friends from different phases that will periodically check in or be willing to be that person that you can phone when something becomes where you're feeling a certain way, whether you're lonely, you're feeling frustrated, you're excited and you want to share a win. It's cultivating those types of relationships that you have, and not letting them fall to the wayside because we're so focused on the current goal at hand of the test, or the finishing a program, a medical school program, or right. So those types of relationships are going to be an important piece that sustain you no matter where you're living, or what stage of training you're at.
Yeah, I feel like it's such a common problem to be obsessed with your work, whether it's a job, whether it's school, and you're just constantly drowned in it. And eventually you look around and you find that you haven't met that many people. So you have to kind of surround yourself and detach it because like you said, there's always going to be a big test. There's always going to be a big next hurdle. So just find yourself and find your own people too. Yeah.
In order to be able to do that, Andrew, right? Like I think it's important to there's going to be activities that are hosted, and you might not feel like there's time to do that, but taking 30 minutes, going and engaging, you might meet a lifelong friend, or you might meet a colleague that you want to do more outside of that one activity, that helps propel the rest of your time at a certain institution, or so it is important, because you could easily isolate yourself. There's a couple of reasons why. One is you're probably, all of us enjoy learning and we enjoy the topics that we're engaging with. The other one is there's always more work and stuff that needs to get done than hours in the day to do it. And so you really have to schedule those other portions of opportunities outside of the work at hand, um, not only to create those connections, but in the field, one of the things that we're struggling with in general is burnout. And burnout doesn't happen just when you become an attending. It starts really early on in how you're planning and engaging in your early career as you're making it to the final destination.
True. All right, so we're gonna switch over a little bit to more of like quick answers of small tips on many different things. So,
Okay.
all right, so how have you dealt with imposter syndrome and how could you kind of avoid it or reduce it?
I think one of the things to understand is a lot of us struggle with it. And now that there's actually a term for it, you could say, oh well, I guess I have imposter syndrome. The reality is many of us feel like there's so much more that we could know or should know than where we are at the moment. And for me, it was always taking taking a second when I was feeling that feeling, taking a second to reflect of why was I feeling it, and try to re have it sort of restate a different narrative in my mind for it, right?
Yeah,
Because oftentimes it's not, it's something that's internal that is being manifested in that way. It's not necessarily something that is being perceived from the outside. So for me, what helped me was, okay, take a moment, recognize that I was feeling it, take a moment to understand what about that situation made me feel that way, and then hype myself up, knowing how far I've gotten and that there's a reason I was there for that particular task. So it takes time, it takes practice. Sometimes having another person that can help you see that if you're not seeing it in yourself can be helpful. But it's also recognizing it's not just a medicine. People feel this in different areas of work and in their lives. And it's more about reflecting what is driving that feeling and how can you change the narrative when it happens.
cool. So we just spoke about finding time and time management. So how do you make time for your hobbies?
I'm doing better now, Andrew. So it's not something, it takes time, right? So I
Yeah.
wish this is something that I wish I had. Well, at the time when I was doing training, it wasn't at the forefront, right? In terms of thinking about life outside of academia or of the areas that you were engaging or pursuing. There's been a change in the medical field and medical training where we're recognizing that these are habits that we should be forming early on in life. Um, and so for me, it took me a little while. And again, part for me was I love learning. I could be immersed in a topic and it doesn't feel like work always. But there comes a time in life where you may have responsibilities outside of work, things like family or trying to create a family, trying to find a significant other, trying to, you know, think about yourself outside of medicine. And for me, the only way that I could, it took time working with my partner in recognizing that I was, how I manage my time. The other piece is scheduling things in my calendar as if it was work related in my mind, but it was all right from this time to this time, I'm going to exercise because guess what? I have to be healthy to be able to take care of other people. If I plan to have an event like on the weekend, there are going to be certain days where maybe I work longer hours so that I'm not touching anything on the weekend.
Mm.
I've gotten better at that. So there is most weekends I don't open a computer and I don't engage with work, but that means that sometimes in order to make sure I'm staying on task, there are going to be some days where I do work later hours, or certain weeks where it requires a little bit of time, where I'm not engaging with that hobby or my family at the moment. So, when we talk about balance, this idea of 50-50 does not exist. I think it sets people up for failure. What
Yeah.
you want to do is recognize what are important things in your life that you need to schedule in your day and figuring out for that week or for that day what allows you to do that. And then also recognizing that you will not, there's times where you're not going to complete everything. So, what is the priority? And so sometimes the priority is I need to exercise because if not, my mental health is not great. Or the priority is I need to finish these notes because if not, I'm going to be delinquent on them. So it's prioritizing the task so that you have a full breadth and balance in that way. But sometimes work is going to take more time than your external hobbies, and sometimes your external hobbies win, and work is taking a back end.
Cool. And what's one question you wish more pre-meds or mentees asked you about?
Oh, that's a good question. Um,
Thank you.
yeah, I think two things. One is I wish, and I sort of lean from it from some things that I wish I had known.
Mhm.
One is it is a long journey that you're signing up for, particularly pursuing a medical career. And so one there's also financial implications to that. Having been someone that didn't come from a lot of money and did all of their training through loans, I wish I would have known more about how to be financially responsible during those times to set myself up for success once you're done. Now, the reality is that a lot, once you're done with your training, you catch up pretty quickly. But there are some things that could help from that financial standpoint to ensure that you're not dealing with something that you didn't anticipate down the line. The other one is being a female, I think, and things that we don't talk about often because we're so engrossed in, but it's not just from the female perspective, engrossed in our work is family planning and what that might look like uh, along the path of having uh, uh, an educational journey that could be easily 10 plus years, right? And what does that mean from a family planning perspective, if that's something that you would want down the line? And I don't think we talk about that enough um, along the journey um, of education in this space.
On a fun note,
Yeah.
could you tell me what your favorite cultural dish is? It could be a dessert, it could be a meal, it could anything.
Oh my gosh. So in the Puerto Rican culture, there's something called a canoa, which is a sweet plantain that has ground beef and cheese and sauce on it, and it is one of my favorite things to eat from a dish perspective. Um, the dessert, oh gosh, I don't know. I love ice cream, so any kind of ice cream is my favorite dessert, and I could eat that every day if they let me.
Do you have lucuma in Puerto Rico? Do
I
you know what that
don't
is?
think so.
Oh,
No. What's
okay.
that one?
Well, it's orange ice cream. It's a fruit in Peru. So I think it's just slowly Peru.
Oh,
Yeah.
oh my gosh. I need to have that. I need to go find some.
It's pretty good. Yeah, yeah. Okay. What is one quote or piece of advice that you live by?
So, I went to a Jesuit university, and there was a quote that I had learned there that I think really carried me forward, and that I think about when I think about quotes, and it's go forth and set the world on fire.
Okay.
And that can mean a lot of different things, but that definitely is something that I find telling myself, particularly when I think about what's my next step, how do I want to get past the challenge, what I can contribute on a larger scale to my community, to my patients, to my family, to myself. And so I've always enjoyed when I find myself, I repeat that quote to myself and just get myself moving.
Okay. Yeah. And one of the last questions. So this one's a very new one. So if you're a little surprised, then it's okay. But if someone were to ask you to pick one sticker to represent yourself, what would you pick? It could be a instrument, it could be something you're passionate about. I don't know, anything.
Yeah, a son. I think it's what my name means. I think it is a good reflection of the type of person I aim to be. A bright light in a space, welcoming, comforting. So my sticker would be a sun.
Okay, yeah. And the reason we ask this question is because when we do the thumbnail, we have the professional headshot of the guest, then we also have a sticker. So it's a new thing, but I kind of like it because it's like, oh, this is one thing I want to be known for. You know what I mean?
Yes, absolutely. I think, yeah, and it tells a lot about a person, like what they're
Yeah.
going to choose as their sticker. I could have chosen a brain, right? That's my other one. But, I thought of myself first in terms of the personality aspects of things.
All right, so what do you say about doctors who tell pre-meds or students not to pursue medicine? A
Ah,
little controversial.
yeah, that's a tough one, right? I think, um, when you hear that, the first thing that I think about is what is driving that person to say that, right? And I think we have to acknowledge that the field of medicine is changing,
Hmm.
that the role of the physician is changing, and that we I feel like when an individual says that it's coming from the place of trying to protect another person, right? Like make sure. I think what I read into that comment is make sure you know what you're getting yourself into because it is a lifelong, right? There's a lot of sacrifices along the way that you make. It is not a typical job or career that you could easily just say, that's it, I'm done, right? There's a lot of implications for that.
Yep.
There is a financial commitment that you're making to pursue something like this. And at the end of it, you want to make sure that the person that's entering, as you're thinking about it, is can you do this right for the rest of your life, or do you want to do this for the rest of your life? Are you entering it for the right reasons? Um, the way of medicine sort of shifting towards the business aspects of things. Um, what drives individuals to medicine initially may not be how they can practice after they get out. And I think these are all those things to consider, right, when you're thinking about this career, because we have this perception of what a doctor is and how a doctor practices. but the realities of it are changing based on some of the demands of, insurance, the institutions that you work in, the needs of the patient population. And so when I hear that, it's more like, have you really thought about what is driving you towards this field? Have you been exposed in a way that you can really answer that question? And once you enter, you want to make sure that it's fulfilling you as a person as well. Because along the way, it is challenging and you do make a lot of sacrifices to practice at the end of it.
Last question. If a listener were to listen to this and not have heard a single word, what would you what would you say to them for them to remember you?
Oh, I love this question. I would say every path and journey looks different.
Mhm.
Um, do not compare yourself to somebody else's journey. You are on a unique place and you have unique experiences, and be open to the possibility that it looks different than what you think it's going to look like. Because at the end of it, I hope it's an amazing place you land, doing the kind of work that you envisioned yourself doing, making an impact,
Yep.
interacting with people in a positive way, and making the difference that you're hoping to make while still feeling fulfilled and engaged in that process. So the journey looks different for everybody. Some people have a straight path, some people don't. Don't compare yourself to others. Just make sure to ask for help when you find that you're not in the direction that you're hoping to get to. And wherever you are, be present, enjoy the process. Each day is an important piece. And people miss that along the path. They wait till the end point. You really want to be present and enjoy the times that you're in now, because they make you who you are and make you the provider that hopefully you'll be at the end of the path.
This is AP Med ex LMSA Northeast. My name is Andrew Poveda, and we just finished interviewing Dr. Silda Jesus, a neurologist at Penn State University. Thank you.